Proper care after a tooth extraction is critical for healthy healing. The most important goal is to protect the blood clot that forms in the socket, which stops the bleeding and begins the healing process. Keep biting firmly on the gauze pad for 30 to 45 minutes after leaving the office to stop the bleeding. Replace the gauze if it becomes soaked, placing a fresh, damp gauze pad directly over the wound and biting down firmly for another 30 minutes. Do not spit, rinse vigorously, or use straws, as the suction will dislodge the blood clot and/or bone graft and cause a painful condition called dry socket. Do not smoke or use tobacco products for at least 72 hours, because nicotine decreases blood flow and severely delays healing. Avoid strenuous physical activity or lifting for the first 24 hours to keep your blood pressure low and prevent renewed bleeding. Take pain medications before the numbness wears off to stay ahead of the discomfort. Follow the 3-3-3 rule if recommended by your provider, taking 600 milligrams of ibuprofen, typically 3 200 milligram tablets, 3 times a day for no more than 3 days to maintain consistent inflammation control. If more pain relief is required, you can add 500 milligrams of acetaminophen. Apply an ice pack to your face for 15 to 20 minutes on, then 15 to 20 minutes off, during the first 24 hours to minimize swelling. Keep your head elevated with extra pillows when resting or sleeping to help reduce throbbing and swelling. Drink plenty of fluids, but remember to avoid using a straw. Eat only soft foods like yogurt, applesauce, pudding, mashed potatoes, or soup. Make sure it is lukewarm, not hot. Chew on the opposite side of your mouth to keep food particles away from the extraction site. Avoid hard, crunchy, spicy, or sticky foods for several days, as chips, nuts, or seeds can get trapped in the socket. Do not brush or floss the teeth next to the extraction site for the first 24 hours to avoid disturbing the wound. Brush your other teeth gently and let the water rinse out of your mouth passively instead of spitting. Begin gentle, warm salt water rinses, half a teaspoon of salt in a glass of warm water, after the first 24 hours. Rinse 4 to 5 times a day, especially after eating, by gently swirling the water and letting it drool out into the sink. Oozing is normal for the first 24 hours and can make your saliva look bright red. Some bone graft material could ooze out and feels like small amounts of sand. This is normal. Contact your dentist immediately if you experience severe, throbbing pain 3 to 4 days after the extraction, as this is a sign of a dry socket. Call the office right away if you develop a high fever, severe swelling that worsens after 3 days, or heavy bleeding that does not stop after biting on gauze. Hospital emergency room visits are not advised. Hospitals lack the radiographic equipment and the knowledge to diagnose or treat dental problems. Their only option is to prescribe antibiotics and/or pain medicine and then refer you back to your dentist. This results in added expenses for you without any real solution. Gold Coast Dental has offices that are open 7 days a week. Please call 562-242-1411 if you are unable to contact your dental office. Please refer to the written instructions that were provided to you for further instructions. We wish you a speedy recovery.